Good morning. Myself, Virupaxi Savadi, Assistant Professor, Child Health Nursing Department. So today's class will discuss one of the neurological disorder, that is meningitis. Meningitis, it is one of the neurological disorder. There is a more chances of occurring this is in the neonate and the infant age group of the children. And overview of the today's topics. So today's class will discuss regarding the introduction of the meningitis, definition of the meningitis, and the classification of the meningitis, signs and symptoms of the meningitis, pathophysiology, diagnostic evaluations, and the management. Under the management, we are going to be discussing about the pharmacological management and the medical management, the nursing management, the meningitis. So first we start with the introduction. This meningitis. Meningitis is a disease caused by the inflammation of the protective membranes covering the brain and the spinal cord, known as the meningitis. It is a major cause of the hospitalization of children with a high mortality rate. And the inflammation is usually caused by an infection of the fluid surrounding the brain and the spinal cord. Meningitis caused by the meningococcal bacteria. So in these slides, you can see that there are more children are suffering with the meningitis, and this meningitis is a disease caused by the inflammation of the protective membranes covering the brain and the spinal cord, is known as the meningitis, and it is a major cause of hospitalization of the children with the high mortality rate. And meningitis is caused by the meningococcal bacteria. Next, we'll see the definition of the meningitis. Inflammation of the meninges covering the brain and the spinal cord is called as meningitis. Itis means inflammation. Here, the inflammation of the meninges, the covering the brain and the spinal cord. We can see the one more definition also for the meningitis. The meningitis is an inflammation of the meninges, the protective membranes that surrounds the brain and the spinal cord. So next we'll see the classification of the meningitis. Mainly they are going to the three classification of the meningitis. One is the bacterial meningitis, and second one is viral meningitis, third one is the tubercular meningitis. The bacterial meningitis, it's also called as acute phyogenic meningitis. This acute phyogenic meningitis, it is caused by a bacterial infections. Like acute bacterial meningitis is more common in the neonates, infants, because due to immature immune mechanism and poor phagocytic functions. There is a more chances of spreading the bacterial meningitis in this neonates and the infant age group of the children, because there is a immature immune mechanism and the poor phagocytic functions. And the bacterial meningitis is almost always complications of the bacteriemias occurring due to, it may be like there is the pneumonia, empyema, or maybe the endocarditis. Then second one is the viral meningitis, the second classification of the meningitis. And this viral meningitis also called as aseptic meningitis. The aseptic meningitis, it is caused by different viruses, fungi, or maybe the protozoa. It is relatively common, less serious, and the sign of meningeal irritation develop 1 or 2 days after the onset of illnesses. So here there is a viral meningitis because of due to there is a cause by different viruses. It may be like there is a fungi or maybe the protozoas also, and it is commonly less serious, developed in 1 or 2 days onset of illnesses. Then third one is tubercular meningitis. This tubercular meningitis, it is the caused by the Mycobacterium tuberculosis. Okay, so these are the three classification of the meningitis, and you can see that. The next is the etiology of the meningitis. There are already we've seen that there are like the inflammation may be caused by the infection with the viruses, bacteria, or maybe the other microorganisms. The organism cause meningitis mainly in neonates, infants in younger than the 2 months. Like there is a group B streptococci and E. coli accounts of there is a 70% cases of the meningitis. Almost any bacteria entering the body can cause the meningitis. It may be common like cancer that meningococci, pneumococci, or maybe the Haemophilus influenzas. And organisms like E. coli, streptococci, and the H. influenza and Streptococcus pneumonia. These are the main cause. There is a chances of occurring uh, meningitis in the children. Next, as I have told that the etiologies of this meningitis in this bacteria and the viruses, protozoa and fungi, these are the main cause. In the virus causes, the virus like it may be the enterovirus, arboviral virus, or maybe the influenza virus, or maybe the herpes simplex virus, or maybe the varicella zoster, HIV, mumps, and the measles. These are the viruses there is a more chances of occurring the viral bacteria or in the virus bacteria. The next is the bacterial meningitis. The bacterial meningitis like Haemophilus influenza or maybe the Listeria, meningococcus, mumps, pneumococcus, group A streptococcus and the group B streptococcus. These all the bacteria they may can be cause for the bacterial meningitis and these cause there may be the chances of occurring in the children, in the infants and the neonate age group of the children. According to there is a statistics, there are the more children are suffering with the these meningitis cases the uh, countries. And next we can see the pathophysiology of this meningitis. The can see that there are the main causes like it may be the virus, bacteria, protozoa, fungi. Because of due to this, all the etiological factors, once these organisms and the viruses reach the nervous system by the many route. Once it enters to our nervous system, like there is a most common route of bloodstream and bacteria in the nasopharynx enter the bloodstream during the upper respiratory tract infections. Next, it leads to once the organism reaches the brain, the CSF in the subarachnoid space, arachnoid membranes, and the become it gets infected because of due to the organisms, bacteria, and the viruses, it reaches to the respiratory infections during the upper respiratory infections, and the organism reaches the brain and the CSF and the subarachnoid space, arachnoid membranes are become infected. Once the arachnoid membranes become infected, then next it leads to infection spread rapidly throughout the meninges and eventually invaded the ventricles. Okay, here the ventricles it will be get the infected rapidly throughout the meninges. Once the ventricles is get infected, the next it leads to there is the inflammation and the multiplication of the organisms automatically that all once enters the nervous system then it will starts getting the multiplication of the organisms. Once these inflammation and the multiplication of the organisms, then next it leads to there is the increase the CSF fluid exudation in the ventricles. Okay, so automatically that multiplication of the organisms and next it leads to there is the fluid exudation in the ventricles and next it will increase the intracranial pressure, cell count and the protein levels. Once this all the at a time it is increased ICP, cell count and the protein, the next the compression of the brain ischemias and the stroke they may be the chances of occurring. The next, once these occur, there is a meningeal irritation due to inflammatory procedure of the clinical manifestations when you can see with this meningitis cases. Then next, we can see that as I have told that there is a more chances of occurring this meningitis in the neonate and the infant age group of the children. Once it's occurred to the neonate age group of the children, like the clinical features in neonates includes like the forefeeding, they may be the we can say that, okay, and vomiting, diarrhea, lethargy, weak cry, sleeplessness, presence of full fontanelles. Okay, these all the signs and symptoms mainly you can see that which the children are suffering with the meningitis. Like the neonate age group of the children, these all the symptoms mainly you can see that. And the next, which the children are having the infant age groups, like the infants older than the 3 months includes like there is the fever, irritability, overfeeding, and the vomiting, seizures, bulging spontaneity, and the rectal rigidity. Okay, these all the signs and symptoms, okay, or the clinical features will be there in infants older than the 3 months includes. Then next, the other the signs and symptoms generally you can see that in the age group of the children's according to this age group of the children's, like the fever will be there which is the children's are suffering with this meningitis. You can see these all the signs and symptoms, like fever will be there, severe headache, nausea and vomiting, lethargy, weak cry, and the knuckle rigidity. Knuckle rigidity means what? This is the resistance to flexion of the neck. Means the spasm in the muscles of the neck, forceful flexion causes the severe pain. The next one is the positive curling sign. These positive curling sign, this symptom also mainly you can see with the children. Those children are suffering with the meningitis. Like there is a the curling positive sign means with the patients in the supine position and hips flexed, passive straightening of the leg at knee causes the active resistance and the back pain will be there. With that sign, you can call as the positive curling signs. These sign also will be present in the meningitis cases. The next is the positive Brudinski sign. Okay, these positive Brudinski sign also the children, those who are suffering with this meningitis, those children easily can find out this sign. Involuntary binding of the hip and the knee on the passive flexion of the neck. The next photophobia also you can see that, and the phonophobia also can see these signs and symptoms. Photophobia means an inability to tolerate the light. Phonophobia means intolerance to loud noises. Okay, and next is a decreased loss of consciousness, presence of full fontanelle, and sign of decreased intracranial pressure. These all the signs and symptoms mainly you can see that when the children are suffering with the uh, meningitis. The curling sign means already I have told that here in the this picture also easily you can see that one of the physically demonstrable symptom of the meningitis is curling sign. Severe stiffness of the hamstrings causes an inability to straighten the leg when the hip is flexed to the 90 degrees. The Brudinski sign means the another physically demonstrable symptom of the meningitis. Brudinski sign, severe neck stiffness causes the patient hips and the knees to the flex when the neck is flexed. That we can call as the Brudinski sign. These also easily can be seen this week. Okay, how the Brudinski neck sign will be there. And here the Brudinski sign, severe neck stiffness causes the patient's hip and knees flex when the neck is flexed. Okay, these all the symptoms mainly you can see with the meningitis cases. Then older children and the adults also they are having the symptoms like high temperature, vomiting, sometimes diarrhea, severe head, uh, severe headache also considered, joint muscle pains, dislike of the bright lights, drowsiness, and the patient may be confused or disoriented. Okay, these all the symptoms mainly you can say that. And next is the diagnostic evaluations. Okay, when we are going to be find outing this meningitis, we have to be do the diagnostic studies. So here first we are going to collecting the history of the patient. Okay, the history is like in the etiologies we've seen that it may be the cause like bacteria, virus, or zoa, or maybe the fungi. We are going to collect the proper history of the patients. The next we are going to do the physical examination. Okay, in the physical examination, as we've seen that there's a signs and symptoms like positive curling signs, Rodunki signs, or maybe the knuckle rigidity, photophobia, and the phonophobia. These all is you can be find out that. Then the lumbar puncture shows the elevated pressure. Then the blood examinations reveals the leukocytosis. CT scan, MRI, okay, and the EEG also can see that. Then the CBC like coagulation profile, electrolyte levels, and the glucose platelet count. And the computed tomographies and MRI may reveals the hydrocephalus, and CSF examination shows that there is a WBC count is raised predominantly and neutrophil count, the protein level is high and glucose level is markedly decreased to the below the 30 mg. So here you can see that how they are going to be removing these conditions. Then complications of the meningitis, like you can see that with this meningitis, the most complications of meningitis, the neurological dysfunctions, like there is a subdural effusion, or maybe the cerebral infraction, encephalitis, endocarditis, and the hydrocephalus. These are the main complications of this meningitis. The next is last comes that that's the medical management of this meningitis cases. Like we can give the administer of the drug therapy as order the meningitis. Like there is a penicillin used to treat the pneumococci, and broad spectrum antibiotics, ampicillin, gentamicin, taxim, Ciplox, these all the medicines I will give, and antibiotics therapy is 7 to 14 days depending on the group of the type organisms, and 3 weeks the cause of the gram strain. And dexamethasone also maybe to treat this one they will give, and corticosteroids, IV fluid to prevent the dehydration and shock they will give. For nausea and vomiting, antiemetics they will provide, and diazeform and the pentine is used to control the seizure cases. Okay, the last step, that is the prevention of this meningitis. How can we prevent this meningitis? The routine immunization is helpful in preventing the meningitis. Vaccination against the measles, mumps, and the polio, meningococcal, and the pneumococcal organisms can protect the child from the meningitis. And 3 doses of HPV vaccine should be given to the child to prevent the occurrence of the meningitis. Last one is the nursing management. Here we have to be do the monitor of the vital signs constantly and determine the oxygen from the arterial blood gas values and the pulse oximetry. Maintain the fluid intake and nutrition. Provide comfort and rest. Control the seizures and protect the child from the injuries. Administer the antibiotics therapies as prescribed, and give the oxygen to maintain the arterial partial pressures of the oxygen. Then next, provide the comfort and the rest. Monitor the child condition and parental guidance and support. Okay, these are very important. How what the psychological support the parents are need, and the monitor the child condition. If there is any side effects, if there are the complications, if there are the child is uncomfortable in the hospital, that we have to find out, and we have to give the monitor the child condition, reduce the high fever, decrease the loss, there is a load on the heart and the brain from the oxygen remains. And always we should be see the children's provide and comfort and rest, maintain the fluid intake and the nutrition we should be observing. Sometimes they may be the chances of occurring, they control the seizures and protect the child from the injuries. Unknowingly, the children's anytime they can be get any the seizures, no, we have to be protect the child from the injuries. And always we should administer the antibiotic therapy as prescribed by the doctors. Okay, so these are the nursing diagnosis like impaired thermoregulations due to infection due to meninges and the risk for the fall and injury, altered level of the consciousness, and the nutritional imbalance less than body requirement related to nausea and vomiting. Thank you. Okay, so till now we'll discuss that regarding the meningitis from the definition, clinical manifestations, and classification of the meningitis, and all the signs and symptoms of the meningitis. And older children and adults, all the symptoms are having the clinical manifestation, diagnostic evaluations, then complications of the meningitis, and the medical management and the prevention of the meningitis. Thank you.